everyone, I'm Joyce the Dentist. Have you ever wondered if you should get dental veneer treatment because of one dark tooth in your smile? Now, normally dental veneers are applied as a set. Depending on how wide your smile is and how many teeth are visible, that might mean anywhere from 6 to 10 veneers across your upper front teeth. But if you only have one really bad stain on one specific tooth, can you or should you get veneers? For that matter, should you even consider a single veneer? First, let's talk about why that tooth stain isn't whitening out in the first place. It could be due to something like severe tetracycline staining, or maybe it's even enamel fluorosis that occurred when your tooth was developing, resulting in one of those little white or brown patches. It could also be nerve damage. There are certain types of intrinsic or internal stains that don't usually bleach out, even if you're having your teeth professionally whitened with a strong product. As a result, the best way to improve the appearance of those teeth is to cover them up. That could mean getting a veneer, a crown, or even having your teeth bonded over with some tooth-colored composite. There are a ton of different variables that you'll need to consider. But first, I would be sure to rule out non-invasive alternatives like whitening or bonding. Both of these are also more affordable than getting a veneer. Now, as a cosmetic dentist, I will say that matching only one veneer to the rest of a smile is one of the most difficult situations in dentistry. Getting an exact color match can require a lot of planning and back and forth with a very meticulous, high-end lab. The cost for doing a single veneer can also be way more than the cost per tooth to do a set due to the difficulty level. That's why most patients will opt to get a set of 2 to 4 at minimum. Doing only one will also increase the need to maintain the color of the surrounding teeth to that one veneer. One of the main reasons that sets of veneers are done is that when we're adjusting the way that your front teeth look and a lab is involved, we want to make sure that all of those restorations are crafted at the same time with the same materials from the same person. That way they have the same color, same hue, and same surface texture. Let's say you get one porcelain veneer now, and then later you decide you want to go ahead and veneer the other teeth. Even when using the same lab, it's very difficult to get exact same match. So coming back at a later time and trying to match the design is not recommended. My motto is always to do things once. Do it right and make sure that you love it. Sometimes this means that it's best to wait and do what will yield the best results instead of doing a little bit here and a little bit there. Another common scenario where a tooth is dark is when it has a composite restoration that has stained over the years. Although composite veneers require less tooth preparation and can quickly cover up aesthetic issues in specific teeth without affecting the entire smile, the drawback is that they are not as long-lasting in staining environments. Patients who have been wearing a composite restoration for a long time are often ready to replace them with porcelain veneers that can give them a more uniform look and provide longer lasting results. Before we wrap things up, I do want to talk about one other option, and that's a porcelain or zirconia crown. Why do I even bring that up? Because some teeth have extensive discoloration that's tied to things like large areas of tooth decay, or a dying nerve that needs endodontic therapy or has past root canal treatment. All of those scenarios can sometimes require extra reinforcement so that the tooth doesn't break down. A crown can offer a lot of the same aesthetic advantages of veneers, but it also serves a restorative purpose. Since crowns cover the entire tooth, they reinforce it so you can keep biting or chewing without worrying quite as much that something is going to break. But in this case, the benefits are twofold because the crown also covers the discoloration and helps your entire smile look its best. If you're unsure about whether or not you should get a single dental veneer, be sure to talk with a cosmetic dentist in your area who you trust, or even consider getting a second opinion before you commit to treatment. Well everyone, that's all for today. I'm Joyce the Dentist. Smile smarter. I'll see you next time.